Hello, I'm Dr. David Torres. I'm a clinical psychopharmacologist, and I'm here to talk about the GABA receptor. You can learn more about the GABA receptor in my book, The Art and Theory of Bipolar Medication Management, and by going to my website, shrinkharmony.com. GABA, or gamma-aminobutyric acid, is a major inhibitory neurotransmitter in the brain and constitutes about 70% of the nerve cell connections in the brain. We learn as children through the excitatory actions of the neurotransmitter glutamate, which is a precursor to GABA. GABA neurons inhibit our actions to be in accord with how we should act socially. The GABA receptor is a complex pentameric structure with 4 submembrane units. It has multiple binding sites for both positive allosteric modulators and negative allosteric modulators. Allosteric modulators increase or decrease the sensitivity of the ion channel to ion influx. In the case of the GABA receptor, medications modulate chloride influx into the nerve cell, thus causing more or less inhibition. The benzodiazepines are positive allosteric modulators, which increase the influx of chloride into the GABA neuron, thus increasing inhibition through hyperpolarization of the nerve cell. The G drugs, like Ambien, Lunestin, Sonata, are rapid-acting sleep agents which work effectively at the GABA receptor but are not benzodiazepines. They have short half-lives and can cause memory impairment, coordination, sensory problems at peak plasma levels. These drugs act at the GABA-A receptor, but there is another GABA receptor called a GABA-B receptor, which is a G protein-linked receptor, which binds a medication called baclofen, which is an antispasmodic agent. All of the agents talked about so far are positive allosteric modulators, but there are negative allosteric modulators which theoretically may improve memory, but tend to cause anxiety and seizures like picrotoxin. There are 2 medications that structurally look like GABA, but do not bind the GABA receptor. These are the alpha-2 delta ligands and are Neurontin, or gabapentin, and Lyrica, called pregabalin. They are structurally similar to the amino acid leucine and bind voltage-sensitive calcium channels. We do not know exactly how these anti-seizure medications work, being very small in size, but they have an anti-anxiety effect and do not cause the side effects that the benzodiazepines or Z drugs cause. You can learn more about these medications, my book, and how to attend my neuroscience office lectures on Mondays and Wednesdays 6 to 7 p.m. and Saturdays 9 to 10 a.m. Colorado Mountain Time at shrinkharmony.com. From shrinkharmony.com, I'm Dr. David Torres. We'll see you soon.